Hello my dear girls, for today's lesson we will need our suction cups and that's it. We will start with the exercise when we place our hand on our waist and our ear to our shoulder and then up the opposite leg, toes up. We trying to combine all of this folds here and stretch this part. We stay here for 30 seconds. Just like this, breathe. Breathe, breathe, breathe. And slowly get up and start stretching. Very deep. No superficial stretches, right? What you compressed, you need to stretch. So right here, you stretch. You can start, I'm pretty sure your tissue is already letting you to a deeper levels, so you can start not like this, you can start actually inside and start vibrationing like this, moving the tissue up. Don't think about the skin, think about the fascia, the muscles that under the skin. That's why you cannot move fast at any point, because the tissue will just pull you out if you move fast. Stretch up to your almost behind you, your second side. This, I'm putting my hand on a waist, my opposite leg toes up. That gives me a great stretch. And we are working on our neck. Today is a jawline, under eye bags day. Very interesting how will results you get, girls get, because we going into the deeper techniques and we already did a lot. So right now you will actually reap the benefits, start reaping the benefits. Hold, 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 toes up. No lower back pain, no discomfort, just a little stretch and compression. Slowly get up, and again with the idea that you get in and you do this type of vibration movement that's gonna let you in a little deeper and stretch. Stretch. We're working with a very important area, not only our carotid artery, also our jugular vein, and they both has to work because the bad stuff has to go out first before the good stuff can come in. And our body knows how to repair itself. It just needs the material, and the material comes only with blood. Now you place your finger inside of the ear, and we work on the sternocleidomastoid. Who have troubles grabbing your muscle, you can tilt your head like this, and you see it exposes more, versus if you try here. So finger into the ear, with the intention of bringing this side of your face diagonal up, but don't really push it. Intention and attention. And this hand is walking on your sternocleidomastoid, which is opposite direction. Inhale, and tongue on upper palate. Exhale. Inhale. All the way. Good. Great. This side should feel lighter, but don't get upset if you don't feel anything. It's also normal. You just getting those connections on. So inhale, exhale. good. Very good. Now we will work with our throat. So very lightly vibration. Right now we're working on osteopathy. So osteopathy, it's never push, it's just intention that creates a movement. We will take our throat, swallow. You will feel that hyoid bone. So take it like this from two sides, and little vibration. So little movement. While your tongue, this is tongue forward, and you're gonna try to bring your tongue toward the throat when it's straight, not folding it, just straight. So, and vibration. 30 seconds. Inside, tongue closer to the throat. Breathe, be there. Relax. Now we will work right under your chin, There is the muscles that originates from there, so there is very tense there, right chin and down and on your jawline. And you just let's start using our suction cups for a reason. You can take the small one or the upper one, and I want you to work with that suction cup on your bone. So the bone, the muscle gets to the bone, and we want to relax those spots. Usually it's the most tense spot, it's when the muscle meets the bone. So right here, it will be 1, 2. This hand is pre-tensioning, so I can go deeper, because clearly I will need to work on the bone. You can do it with your finger, but this is just when you work with the device. The pressure is a little increased and your fingers are resting. Just one spot, little circles. And now the second spot. Twenty, 30 circles on one spot. You might feel that one is much more tighter than another one. I'm right now experienced in this. And if you do that, feel that, you can spend a little more time on that area. Now take 2 fingers and slide them down to your throat, and then lightly slide this all here. Press. You lessen the pressure when you're on the neck. Press. You lessen. Here you go pretty deep. And then you lessen the pressure when you're on the neck. Very good. Now we will do the tongue exercises. So, that suction up when the tongue is on the upper palate. You can try to do the sound. So, we place our hands, one on the clavicle and another on the clavicle, and in that position, with your tongue being on the upper palate, we will slightly bring our chin up. Not something extreme, just a little bit. And these hands are pre-tensioning the tissue. So, mouth a little bit open, okay? A little bit, no. Just a little bit. Half of what is possible. And when you're in the highest position, try to bring your jaw forward. Like that. But again, not maximum position, half of what is possible. Breathe. 10 seconds. I forgot to say that we will stay there for 10 seconds. Now we will do the same, but with a little rotation towards one side. Thus, this hand will be putting more pressure to do this pre-tensioning of the tissue. So go up. Tongue, jaw, same idea. Go back to neutral. Other way. Very good. Just a little slapping underneath to remove all potential tension that you created. Very good. Now the tongue exercise. So we know one position when the tongue is like this, yeah? Now what we will be doing, the tip of your tongue going to stand underneath where we were massaging right now. Here. And the bottom, so this is the top of the tongue, almost touching, this is your two teeth, and the root of the tongue is in the upper palate. So the tongue is like this. So imagine that you have an air coming from here and it like parachuting your, like a Medusa type. So one time the tongue is fully on the upper palate like this, and another, the root is on the upper palate. Make sure that everything is under the jaw is looking good. And if it doesn't, if you feel like it's actually making it look bigger, you can use your hands to give that proprioception feedback to the brain that I'm trying to work with under jaw muscles. So, and you open your jaw, not maximum, comfortable opening. You should definitely feel something something going on right here on the sides. Now we will take our hand and start massaging the jawline. Pretense the tissue, because if you don't pretense, this is what happening. And whenever you like, it means that it will take you much longer to go to the deeper level. That's why we pretense the tissue. Trust me, you're not gonna create a wrinkle if while doing the 5 seconds of the exercise you push the tissue somewhere. Like if you're having something here, it's not gonna stay like this. So when you do especially the deep technique, you need to pretense the tissue when I tell you, and it's absolutely safe. Now a little prolong ways. Good. And now again pretense and like a little clumps. You touching, you massaging from both sides. You seeing if there is a fibrosis. Somebody asked me a good question, like, oh, I still feel it. Like, is it a week, 2 is enough to get rid of it? And I was like, I wish, sometimes yes, it's enough, but sometimes it's been there for years and it does take time. It will get better, it will get softer, but not like you did 1 massage session, 3 massage session, 4 massage session, and it's gone. It's doing its thing. It's already improving, but sometimes it's just going to be there for a bit. Now you're gonna slide your finger right under the jaw, very slowly, holding your chin. Making sure that the back of your neck is long, so you're not doing it here. It's very important. And slide down like this. Another one. And see which side has more of those bumpy roads. Now we take our suction cup, make sure that it's clean. And what we're going to do, we're going to work, of course, on our masseter. When you talk under eyes and you talk jawline, you just cannot exclude this guy. So what we will be doing, girls, we're working only here next to the ear. This cheek zone, it's not your masseter, only on your bone. Open, close your mouth. This is exactly where we work, so please don't touch the cheek from here, like this. What we're going to do here, we will go and not only just like we used to just massage, let me show it in my hand, not like just massage it like this. We will massage it like this and we will try to put it down. Massage it like this and try to put it down. Try to lengthen it up. Of course, still there more attention to massaging it as a circle, but you are like trying to grip it and lengthen it down. Okay, it will be 1, 2, 3, 4, 4, 5, 6, 7. So 10 circles, and then you do the grip. But you do the grip only if you are, or like if you're feeling good doing the circles. If it's too painful, don't do the grip, because that's a progression for the technique. This hand is preventing any like faults like this or like this, okay? And just open your mouth. This is the bone, right under the bone. 10 circles, little circles. And a little drag down next to it. And a little deep one, not like you did 10 circles and then you just slide like this. No, it's in drag, not like this. No, you're going in and then you're dragging it down. Then right under. And the drag has to be small, has to be not a long one, because you will lose the depth. Look, up here, so it's very small. Then drag down. Let's try to drop our head on it, and you will see how it increases the what's the name of it, the depth. I finally have my table, that's why I was using the table. You can too. There when you a little drag down. Drag down is the size of the circle, basically. Keep going. Very good. And now take your hands and just lengthen the area where you worked, and see if you feel the difference between two sides, because whenever you work on a masseter, you should be feeling the difference. The side that you just work feels like a little longer, feels a little more relaxed, and the side that you didn't work. So if you don't feel that, maybe you go not deep enough. Let's start again. 1, 2, 3, 4. Wow. Found some spots. Ooh. Chin down. don't miss any of the areas. If for some reason you feel like your bone is a little wider, yeah, you can just stop the video and finish it. You need to work on all masseter. And of course open your mouth. We have to work on a temporalis at least with one little technique. So you're gonna take your hand palm on top of this, on top of the zygomatic arch, and pre-lift the tissue. This hand is laying like this, like diagonally, and you're gonna open your jaw like this. And slightly, not pressing in, slightly lifting the tissue, okay? Drop the shoulders. And when you open your jaw, try to think about bringing your jaw, unless you have this bite, then don't do it. But if you don't have that bite, try to bring the chin slightly up when you do this technique, okay? If you have that bite, just open the jaw. You'll actually balance it. And breathe and slowly slide on the skin. You can add a little vibration. One more time. The most important moment, don't vibrate and move while you open in the jaw. Your hand is here. So it's like, it's actually stretching in a good way the tendons of your temporalis muscle, which is like, of course, you can't stretch the tendons, but tendons has a lot of tension, and that's definitely, in the eye area, definitely not helping our under eye or hooded eyes. So we, and when the jaw open, you can just slide. One more time, let's do it, girls. Sorry, it will be 5 minutes longer than 20 minutes. Now we will take the little one. If you don't have the little one, you will use the finger, but if you have, I encourage you to try. So you will place your hand right here on top of your nose bridge. Is it nose bridge, or it's a little lower? Like here in between your eyes. Pretense the tissue. So you can take your hand like this, so it has a good support. And we will do 12 circles on one spot. It's important to pretend the tissue, otherwise you're going to do it right here. And if you pretend the tissue, look, it's already much deeper. And we're going like this. This is the path, okay? 12 circles there. Yeah, it might feel like you're just working basically on the bone, but trust me, you have a muscle there that preventing that eye outflow, ruining really the eyes, the nasolabial folds. Now, next step. All of this, and you can pretend the tissue even more. All of this, and the girls, the ones that have already very skinny face, yeah? Your muscles are close to periosteum. Like, you need to really go deeper on the bone. For you, it's important to pretend the tissue correctly. And the girls that have more puffier face, you might want to do a little superficial to remove that lymph, because it's like unpeeling the onion, that you can't get to the muscle yet because it's in a lymph gel pillow, it's tensed, it's inside, but the pillow of lymph gel is preventing you to work with it immediately. So for you, you can do superficial and then go deeper. You will find it and you will be very surprised. Now you place your two hands and very, very, very slow and deep opening that muscle. Now we're working with another one. Right on the side, you see how I tilt my head? So I can go deeper. Wow. And once I go deeper, I know exactly this is my muscle. Ooh, this is my mimic. That's why I'm gonna have nasolabial fold if I don't work on it. And that's, of course, just the way I smile, the way I use my face. Ooh. Oh. And of course, you immediately feel your sinuses cleaning up. Not perhaps because the muscle has to do with something with your sinuses, but we work on the sinuses trajectory. Now you're going to do like with your nose and 2 fingers on the side of the nose, just like a little vibration massage while you do that, like, I don't know what's the name of it, like aggressive sniffing, like, I don't know, like this, 50 times. Great. I don't remember if we stretched, but let's stretch this both sides again. And saying O, O, we will go very slowly upward. O, O, O. Now we're gonna close the mouth, hold it here, and again say O and slide down. O on the side. All we work on the side. And from one side of the nose, another side of the nose, you take this and a little vibration. Not super big, you can't do it super big. Just close to the beginning of the nose. Your nose might get runny, that's a good sign. And that's it. See you tomorrow.